Yes, good afternoon. We are about 2 o'clock here in Melbourne. And because in our country, when we are presenting from Australia, we usually like to acknowledge the First Nations people. All right, so I'm going to read this script. In the spirit of reconciliation, the presenter, that's me, would like to acknowledge the traditional custodians of country throughout Australia and their connections to land, sea, and community. We pay our respect to their elders, past and present, and extend that respect to all Aboriginals and Torres Strait Islanders peoples today. Yeah. Next slide. Yes. Now, and as for me, at a personal level, I like to acknowledge my colleague because without their support and encouragement, this presentation could never have been possible. First is Mercy Henry. She is currently a lecturer at Victoria University. She was also an ex-colleague of mine when we were teaching at a private college. She was the one who communicated with Professor Helen Shaji, who is one of the organizers at your conference. Also, she also provided me with some resource coordination. Yeah, and second person that I like to acknowledge at a personal level is Professor Helen Shaji, who constantly communicate with me through email and her encouragement and support that I will get enough support at the presentation. I'm a little bit nervous about that because of distance. Yes. Okay, thank you. Next slide, please, Mr. Soden. Yeah. Now, I just give you a brief overview of what I'm going to present. We will cover our current population, with a graph. And also now, secondly, is to briefly tell you that in Australia, we have a 3-tier health system. That is hospital system, and then we call it primary or secondary. Primary actually is to a GP system, and secondary is like admission to hospital. And the third is usually called community, which is like preventative medicine. Our model is also quite similar to the UK model where I came from, okay? And also, I'll briefly give you some health expenditure between 2021 to 2022, all right? And just a very brief statistic as well in the slide following up. And also, because we are focusing on technology, and digital technology, that kind of thing. So I'll give you a brief overview of the EMR. And what is digital? Why is it that it's important? And last but not least is that I will end up with giving you all 2 samples of a patient cell rating scales. Now, because I'm a mental health specialist, I gave you the 2, which is anxiety and depression scale. Okay, yeah. Thank you, Snowden. You can, yeah. Now, if you have not yet known, is that Australia is at the moment is 26 million people population. ABS, this is according to the Australian Bureau of Statistics, 2022, which was the latest one. We do it every 3-4 years, okay? Now, again, if you have not yet known, is that since the abolition of the 1973 white policy, we have a massive increase in skilled migrants or people coming here because they were refugee status, because they came from war-zone country, or international students and business investors. Now, just a brief overview. Before 1973, there was this white policy in this country. And usually people from UK and New Zealand or Canada, if they have a UK ancestor, it's very easy for them to come in. That is still similar, sort of the same. And because there was what I call reciprocal kind of immigration, so people from Australia, no matter how old or how young they are, yeah, the advantage is that if they have an ancestor who was from UK, they can also go there to work, especially as healthcare worker or other things, all right? Now, we have seven provinces or state. I live in Victoria. This is the smallest state. We got, at the moment, we have 6.9 million people by the June 2024 statistic. When I first came in here, it was about 30 years ago. I came from England. And at the time, I think it's only 5 or 5.5. Okay. Yeah. Shall we go to second slide? The next slide, Snowdon? Yes. Now, see, you can see that. Yes, I love living in Australia. It's multicultural. Now, before I forget, I better let you know that actually I label myself as an ethnic Chinese, Malaysian-born, British subject, naturalized Australian. Okay, yeah, after I came here, after 2 years, I became an Australian citizen. So there's so many people, and I really love living in this country. For instance, even myself, actually, I don't even live in a Chinese area, but I live with the European, and I got adapted to it. I can survive on kebab, pizza, Chinese rice, noodles, and all that. Okay, very hard to get Chinese product in my area, but that's it. But I'm so used to it. And also when I started working with at a company, a private institute, they are run by Indian. I began to have lots of colleagues, lots of friends who are of ethnic Indian background, and yes, I love their curry because their curry is the best. But I can't tolerate too hot curry. Okay, right. Snowdon, we can go to the next slide. Right, this is an overview. I just got the statistic, the latest one for you. Now, when I was doing my PhD research, I was focusing on Chinese population. What is the difference between nurses? Before that, I did a study on nurses between Western people and Asian people. At that time, I tell you what, the people who came in here, the first two, they are from New Zealand and UK. And then the next one, I think it was China and then New Zealand. But you see, the latest statistic now, according to 2022, I have to read now. Of course, Australian-born people have the highest population, and the foreign-born now, they do it this way. Yeah, this is the foreign-born. It's still the 9th. Oh, England is still highest, I think. Yes, that's right. And then India overtaken China now, your country where you come from. They overtaken New Zealand as well and Philippines. Now, you see, New Zealand is a very small country. Maybe that's why they are, slow. And yeah, I give you a bit of time to look at the graph here. The darker color blue is male. And then the female is the red one. Those are yes, they start. Yeah, even I have to look at it. I was looking at it just now. The foreign-born, they are the lighter color. Okay. Yeah. Don't expect. Yes, we can go. Thank you. Yeah. Now, on this slide, I'm trying to tell you just a brief overview of our Australian healthcare system and how much money we spend and how the conditions. Certain condition, how we have improved and all that. But obviously, just like any other country, I think we all went through a very hard time during the COVID-19 pandemic from 2020 to 2023 when the easing off and all that. Now, during the COVID-19 pandemic, obviously, extra burden and demands as admission were higher and top leading cause of the death. All right, this is the statistic that is coming out from the Australia Health 2024. Now, you see, look at that. In brief, there were 43% of Australian aged from 16 to 85. They experienced a mental disorder in their life between those two years or even 3 years. Obviously, probably you even know better than I do. In your country, I don't know what happened. But globally, that COVID-19 have really affected a lot. Look at that. Now, before I go on, now I'll explain a little bit about the mental disorder thing. Now, in our country, we have different type of, we have aged care, we have, the adolescent. And then the adolescent professor, his name is Professor McGrory. Yeah. He actually was Australian of the Year, I think 2010 or 2009, because his focus is that if we treat people from their first psychosis when they were young, then we can prevent the condition to be exacerbated when they're getting older. But while on the other hand, the psychiatrists who are focusing on adult mental health disorder, they would say, well, so where the budget go, like he got a lot of funding to do that. The reason why I could emphasize more on mental health is that I specialize in mental health. Yeah. So, but of course, this presentation is focusing on the digital health, okay, digital technology. Okay. Now, you see, yeah, you have read it. That's fine. Thank you. Now, the three-tier healthcare system. We have a federal government and a state government and also council. What is there? You see that now? We tell you here from here. We have our own public hospital and other programs just like, so maybe immunization and all that, all right? Now, in this state, we all have that. And then the federal government, we have all these health minister and all that, they're different. Now, the Medicare is something that is a very, very good system. If you are Australian citizen, you're born here, or if you are immigrant, you are definitely entitled to this very good Medicare system. You can register with a GP. He is our the first way of getting a specialist treatment or whatever. Now, this one, and then that's the Medicare. And then now in Australia, we have many private hospitals, okay, which is very different from where I came from, England. Yeah. Now we also have private practice. Now this will be to saying that even if you are a doctor, a specialist, you can work in a public hospital. You don't charge the patients much, all right? But you can, if the patient have a private health fund, which is like Australian Unity, like what I have, or either the Medibank or whatever, then they can choose their own doctor. Okay, yeah. Right. Now, let's quickly start on what we are going to talk today, especially the EMR. EMR is the most common digital health that we use in Australia. Now, the first hospital was from St. Stephen Hospital, but I think it's 2014 or something. Yeah, but we also have it here in Victoria. But that hospital, St. Stephen, was in Queensland. Okay. Now, obviously, a lot of good things that we can use the EMR. It refers to some of the technology that we use, like how do we have the electronic referral, which is very easy. Like my GP, he could just, he want me to have some investigation, he can just send it to St. Vincent Hospital because to do a specific investigation, for instance, like 2 months ago. And then obviously, like I think I'm sure in your country as well, all the patients have their own identifier if they are in hospital or either they are under GP in this country. And then we have the electronic health records. I remember the first time I was exposed to this was 2018. I better talk a bit slower. Being ethnic Chinese, we speak very fast. Now, the telehealth, let me explain a bit to you. It allowed the patient to consult a healthcare provider, for instance, a GP, by phone or through a televideo, okay? It was expanded in March 2020, this telehealth thing, more because of the COVID thing, okay? And it's to ensure safety of the patients and the healthcare providers, especially during the COVID-19, because there was lockdown, very hard to get, we were all, sometimes we can only go out within a 5 kilometers, then 10 kilometers and all that. Now, but this services was very good. So we expanded services nowadays, even we're still going on. Just like I can make an appointment just to talk to my doctor on the phone. Yeah. Now, telemedicine is another method of maintaining continuous contact with patients and the healthcare providers. Now, because in this country, we have what we call case manager kind of model of care, particularly in this one, in mental health. Now, there are some of us who can offer private, not exactly private, like we have our what we call we have a provider number for Medicare. So a psychiatric nurse can do that if you are an accredited psychiatric nurse. We call it mental health nurse. But we can also work for a GP if a GP want to employ me, all right? Yeah, like that to do it. And psychologists also can have their own private practice, and social worker as well, okay? Now, this one, the Theleme, is a very good method of maintaining continuous contact with patient and healthcare provider. It is expanded even access to healthcare facility through the use of advanced technology, which we are going to talk later on. Just like all these things, you know, they can remind us, just go through my phone and tell me when am I going to have my next appointment or blah, 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 the kind of thing, okay? Good, the next slide. I have to learn speaking a bit slower. I hope you can understand me, Bill. Now, obviously, I give you the program there that for all this, through even to improve the mental health with EMR, and also this one, even during the COVID-19, which I mean, at the time I was teaching, so I didn't have to be with the patient, but some of my colleagues, especially people who are midwife, it was really a very hard time because, you know, they have to do all these things. But most importantly is that we want to have to improve patient experience and the outcomes. Okay, yeah, right. Now, why is it so good? Because there's this one record, just like I say that the other slide when I say the patient, my patient record, that one, yeah. Into 018, I had that. I know. I don't know where they keep it, but I have that. Now the one record, multiple user, particularly from different locations, you know, because normally in our what we call the countryside, their services is not so good as those of us who live in metropolitan area. Melbourne is the metropolitan area, so it's very easy access and all that. But because of this EMR system, yeah, they don't need to chase around, you know, wasting a lot of time and all that. They can even get it some people, Australian, they like to live in the countryside, massive land, massive house and all that. And they have their own garden, you know, plants, a lot of things. And also, I think we all agree that sometimes it's not easy to read the doctor's handwriting, the piece of prescription or something, you know. And also, we can get our report very virtually. Just like the one thing I can tell you is that my doctor can give the prescription directly to the pharmacist. I just go there and collect my medication. That's all. The telehealth, I can talk to him, and he said, "Yeah, I'll write you for." Here, the PBS, there's something, the PBS, I forgot to tell you, it's called the pharmaceutical-based system services. That means yes, so it's very easy. Also, you see, for those clients, I like to call them clients, that if they need to have their dressing changed by a district nurse or whatever, yeah, the district nurse will get the notice, yeah, and then the patient also, yeah, get a digital health also, yeah, right, like we are actually having an access, you know, like use the word consumer health record. Now, as for me, because I work in mental health, I prefer to use the word clients or consumer, yeah, because our recovery model was based on what we call the consumer partnership paradigm. This is also come from USA, because Australia adopt a lot of USA system. Yeah, I mean, there's some kind of controversy about the terminology that we use, because they reckon we are not buying a product, but because it can reduce stigma. Yes, okay, yeah. That's it. Yeah, very self-explanatory. I'm sure you can read through in this slide, in that the doctor don't need to be there. Okay, yeah. Now the feature is that automatically it will get fit into this system when the hospital or the community or the GP all got all this. All right. So it's called my slide, it was a bit wrong. Yeah, it's to the electronic medical record. Yeah, and it is like real time, having a mobile alert. You know, all those things that I've talked. And also you can trace out what's the patient's, the patient's previous history, you know, do they have any allergy, what medication they were on, particularly refugee or immigrant who have English language problem, okay? Yeah, it's very easy so long as it says that is there. Local remote access also, mobile computer and wheels and tab. Yes, with the tablet thing is that these days, virtually all the nurses who are giving the medication, they charge it on the through a computer or through a mobile, like a laptop like that. And also, yeah, patients who are more alert, they have their own bed. Their medication can be locked in their, in their locker. Just like even when I was working 20 years ago in community, all my clients, I call them the residents, their medication is all blister pack or in locking, or we even let them take the medication themselves, you know, and then we just make so it's okay. Yeah. This electronic meal ordering stuff is that it's even more advanced now. In the past, when I was working, they just order it through a menu. The people from the kitchen, you know, they will come, but now they can do all this. But obviously, we have to train the clients or the patient or the consumer to do it. Okay, yeah, and the IT as well. Yeah. Now, yes, because this presentation also focus on how much a patient can engage in this system. Yeah, obviously, we are not talking about patient with dementia or when they need a lot of physical and mental health care, all right? Yeah. Now, obviously, most importantly, we need a very high-tech IT personnel to help us to establish this. Yeah, from what I know, I think probably in India, I know that India, you have your IT is really on top. You are the IT giant, because I work with quite a few, in the private institution when they need, maybe you can tell me more, you know, we can work together, you know, in the future. Now, here, it is through this called the MAP system. The MAP system, which I'm going to show in the next slide. Anyway, this here, you see, the health information can have the exchange. Then the patient, how do they manage, or how do we manage them and help them to achieve this, that they can even trace out what is their, you know, their history, when they can know, you know, like they will be educated to know how to have what you call it, like recognition of their signs and symptoms, because we have different kind of medical record. Yeah, okay. Next slide, please. Yeah, yes. The MAPS mean this one. The meaning, information, accessibility, promotion, and the staff. Now, you see, this is to the patient are actually engaged with meaningful information that they need and to see the value in it. For instance, like, you know, they are, like I say, signs and symptoms and all that. And then the information must be contextualized to his or her condition and her interest, you see. And how do they access? It is the communication to the patients and through the multiple media. That's it. These days, don't even think that the older generation are less capable of using all these things. They were all very quick with their iPhone and all that, you know, and then WhatsApps and all these things. Sometimes I'm even, you know, I must admit, I don't quite like to use my phone for talking or whatever, because I travel on public transport. But many people, they know, yeah, okay? And this is a very good promotion for patient engagement, so that they don't have to rely so much on other people. Promote their independency and their autonomy for me, yeah. And the step, yes, like you see, it's the provider thing, which is good. Now, digital, what has been achieved? Yeah, this is it. I already mentioned to you briefly that we adopt it. Also, we learn it from the US country. Yeah. Now, that's it. I already mentioned to it. That obviously, we have to spend a lot of time and money. We have to develop a very good IT vendor, and then with someone who knows how to set up the system. Now, with the care pathway, in the general, the general health system or midwifery, they usually use we call it the critical pathway. I didn't include it here because I don't think it's important. Yeah, but in mental health, we use what we call individual care plan. And then this kind of plan, they have to review with the headquarters is in, what is that street? Collins Street in the city of Melbourne. There. Just like when I was doing mental health, we have a 9 category of care for the patient. Usually it's autonomy and empowerment for the patient. We even want the clients to be our collaborator. Yeah, they can tell me what they what they want when I'm looking for accommodation for them, for instance, before they're discharged from the residential area or whatever. Okay, that's what, all those people are very social worker, all those, and psychologists usually help us to do the patient intelligence test and all that. All right. Now, yes, yeah, the pre-admission, let's say, when they really need to come to hospital, they can even do it online, you see, through this system, electronic. Discharge also, yeah, and then we refer them back to the GP. Yeah, that's it. That's what I've told you all. Yeah, it's just make things very easy. Now, nearly coming to an end. As I told you before we started, I say that now I think it's good if I finish off by giving you 2 patient self-reporting scale. This is a scale that is very common. It is called for the anxiety, we call it the GAD, Generalized Anxiety Disorder. There were only 7 questions. And for the depression, is the PHQ-9T, usually 9 questions. Now, obviously, I can, I'm a mental health nurse, so usually I know that many people have anxiety. Okay, and then and it's good that they, especially when they're literate, they can just go and get it from the internet or wherever. Yeah. So now, very bad situation is that during the COVID-19, the incident of anxiety and depression increase. I'm sure, I'm assuming globally it happens as well. Now, leave it for a while. I want to explain a little bit more. Yeah. Now, and because people feel so isolated because of the lockdown, and then people can't visit their relative, can't visit their friend, even a grandfather, just first time a grandmother become a grandparent, they can't even see their daughter and their grandchildren and all that. So it had caused a lot of chaos, Now this scale, usually 0 to 4 is minimum anxiety. So a person, anybody can even just do this, okay? And then the mild is 5 to 9, and then the 10 to 4, yeah, obviously. So they more or less, a person can even identify, are they very severely, anxious or whatever? Yeah, have they? If a person with a history of anxiety, they would have known how to cope with it, because I'm assuming, and most certainly, that they would have got under care of either a psychologist or maybe a GP to begin with, because most people don't like to be labeled as suffering from a mental disorder. So for me, I'm starting to use those terminology, say mental health rather than mental illness or something, Yeah. And then, yeah, this is a self-assessment, okay? At home, right? Good. Yeah. Now, how is it going to help? Now, just a little bit about, because of my own research, I usually use the collectivism and the individualism cultural value system. I have a feeling from your background, yeah, all the delegates, all the attendees are from India. Most of us belong to the collectivistic background. And we highly value family integrity, interdependence. That means people, if they have anxiety or depression, usually our family member help them, so they can sort of improve quicker. But if, especially people of my background, the Chinese background, we have this concept of like to save face. So we do not like to consult mental health specialists, especially if this what you call it, a psychiatrist, and then they will feel that they are losing their face. It can even affect their employment and all that. Okay. Next time, if we have opportunity, I will do a presentation for the college for you. I'll talk more about that. Now, basically, when I was at the private institution where I presented the construct, we call the cultural construct, all my colleagues say they don't know, they've never heard of it, about the individualism and the collectivism, because that construct is usually used by cross-cultural psychologists. And it comes from a Dutch person, you know, and a Greek person. Okay. Now, I feel that maybe it's good that I just introduce that there's at least 4 or 5 types of stigma that's attached to mental illness. First of all, family stigma. If there is first person, we also call it first account. The person itself, professional. Now, professional is also affected as people do not like to go into psychiatry as a psychiatrist or mental health nurse because it lowers their professional status. You know why? Because there's a comparison between someone who is an ICU, intensive care nurse, or who is a midwife. They can deliver baby, all right? But as for me, I really enjoy my work as a mental health nurse, mental health educator. And now that, you know, I like to train more mental health workers because, you know, we need a lot of these people. And to me, it doesn't lower down my status. I don't compare myself with a midwife who's my good friend, you know, from church. Now, another thing is that people, when a person, an immigrant especially, I'm looking at that, or international student, they do not know how to access mental health services in Australia. Okay, yeah. And now, many studies have identified that through education, going to a course of study, or even training. Now, I remember vividly when I was doing my master in research, there was an article that I come from India. That was, I can't remember the year now when they did it. They trained mental health workers and they identify that it always improved their attitude towards mental disorder. So we can actually conclude that it helps them. It helps people. All right. Yeah. Okay. Next slide. Nearly finished, I think. Yes. Now these are some of the. I just give you the what is it? This scale. This one is for the anxiety scale. Now, and yeah, there are this one have only seven. What is it? 7 questionnaire, and anybody can access. Yeah. Okay. The next slide. Yeah. This one is, yeah, it is this here. And I think that the people who put it up on the internet, I think it is Pfizer or something. Yeah. Yeah. Even in some of the religious organization, they do their own, what do you call it? Like during the lockdown, especially. Yeah. Yeah, which since it's easily accessible now, but there are people who do still they don't know. I mean, general nurses obviously they don't know. So I mean, it can help them as well. I mean, I don't know your background. Those of you who are watching this presentation, yeah. Usually you can have dual diagnosis. You know, when you are helping someone with maybe what is it, like after having a stroke, yeah, or after being diagnosed with diabetes. Yeah, they have to change their diet. They can get depressed and anxious. You see, yeah. Okay, so right. Yes, I think it is from Pfizer. Yeah, just like here, you see, yeah, this one is the total. With the total score, this is no good. Severe depression, and even moderately, yeah. But in my practice, we have specific kind of question. If the client is actually, you know, talking with me, the psychiatrist will tell them that, will ask them that certain question that, yeah, you know what, those certain question, it is even though it is very rude question, it is good, because when a person is when everything is on top of their head, is on top of their life, they can feel very useless, you know. So we even ask them question like, oh, when a person is, you know, not happy because so many things happen, a failure in examination, lost a job, despite whether or not it's caused by the COVID-19 pandemic. It's like sometimes just think or lost in a business or going through a relationship problem. Sometimes people can have this freaking thought, you know, that, oh, better end our life or whatever, you see. Now, just for your information is that sometimes we being rude, we can say, do you feel like hopeless, feel like ending your life? If they tell you no, then you put down in your case, you write it down, and then it's in the, what is it, the EMR. So even if a person suddenly ending up, making suicide attempt or whatever, you cover up, you cover yourself as a healthcare worker. Yeah, I hope it makes sense. All right. Yeah, and I hope I'm talking too fast all the time. Yeah, yeah. Next slide. Is it? Yeah. Oh yeah, yeah. These are some of the my references that I use. Okay. Yes, and yes, I really like to uh, to get to know yeah, yeah, your like research person or people who are teaching and in learning. Like if you are teaching in your college through this conference, I really like to ask your collaboration if we can do certain kind of especially because I specialize. My subject is stigma of mental illness. So yeah, yeah. I hope you will help me as well. Some of you, yeah.